Good morning. Good morning to our social media platforms on Facebook as well as on YouTube. This is the Open Arms Community Church in Jacksonville, Florida. And today is a very significant day in the life of the Church of Open Arms as we have sessions for the sister circle that are going on. So if you're en route, if you're at home, we ask you to please make your way here as soon as possible. But also, we are very excited to be able at this hour to present a very important initiative that will be significant in allowing as well as hopefully COVID-19 real soon. We have special guests from the DMV area, persons who introduced Open Arms to this initiative. Bishop Carter, who is my friend, who thought of us in Florida. He said to me, we were the only bishop he knows in Florida. So he contacted me about this initiative, and I've been able to meet Dr. Laura over this collaboration, and she is going to present to us as well today. I ask you, if you are on social media, text, tag, and tell someone that if they would please log on to our Facebook page. That's Open Arms Community Church. This is some very, very important information. Our own Dr. Josie McLeod is going to be presenting as well. And I'm very, very excited because you all know we have a studio audience. I'm going to turn to them in a minute. We have a studio audience of persons who are going to be listening in as well as this presentation goes forward. So at this moment, I want to present to you Dr. Laura Lee Hall, who will give us more information on what's going on and how we can go about it.
Thank you. Thanks so much. I'm going to share my screen because I have some slides. So again, thank you so very much. I hope you all can hear me well and see the slides we put together. I'm going to talk a little bit about the importance of flu vaccination. Since it is now the flu season is really starting to peak up. I want to thank you, Bishop Thomas, for this opportunity. It has been such a pleasure to get to know you. And I also want to thank the Sister Circle. You guys are amazing. I was looking at your work and I applaud you and just thank you so much. So who am I? I work for the National Minority Quality Forum that Dr. Puckrin founded more than 20 years ago in Washington, D.C., and is the president and CEO of. It's really one of the most, I think, influential health equity organizations, not-for-profit groups in Washington, D.C. We work very closely with the Congressional Black Caucus. And Gary has been collecting data to understand the disproportionate burden of disease on people of color all the way to the zip code level. He invited me some 5 years ago to found the Center for Sustainable Healthcare Quality and Equity. And really, it's to help translate that data into action, getting it into the hands of communities and community leaders like yourself, as well as clinicians around the country, so they can make a difference in their own community, in your community. So we have started this year the Faith Health Alliance. And my now friend, but extraordinary leader, Bishop Carter from Baltimore, along with Reverend Dr. King, are co-chairs of this activity. We believe firmly that churches can promote health in communities of color. Indeed, we think they have to be working on this. We need the church to promote health. We're working on flu vaccination at the current time. It's a straightforward and meaningful starting point. I'll show you a little bit of data to support that. But Bishop Carter really worked last year in Baltimore to have multiple churches implement activities to engage, educate congregants in their churches and also link them to services. I also want to just note that this program is being supported by the CDC, and we also have support from Santa Fe Pasteur. So forgive these data slides, please, but I just wanted to show you what you probably already know. So these pink and brown lines represent flu vaccination data for the Black population over the last couple of flu seasons. The yellow and black or navy lines represent the overall population. So one thing and this represents down here the months of flu season, typically. So what you can see is there's a big darn gap here, right? But I wanted to also point out that, people tend to go get their flu shots in August, September, October, and then they think flu season is done. And we have this kind of plateau where flu vaccination doesn't increase, when actually flu risk is highest usually in February. So there's ample time, and it's important to get your flu shot at this point in time. I found this on the CDC website today. Just under 42% of Florida's population, ages 6 months and older, received a vaccine last season, which is the lowest in the country. So some real challenges happening in Florida. This slide just shows you that, and if you look at the brownish color, that is the Black population flu vaccination rates. So you see it here. It's over since 2010, this is. And the disparities have persisted and probably have even gotten a little worse. We actually did a research study of Medicare beneficiaries, and the short of it, I guess the news wasn't only that there are disparities between African American beneficiaries and Caucasian beneficiaries. Notice here that Black women were the most likely to not get the best flu vaccine. And the big news, which was really promoted in the Lancet Journal, is that you can't explain these disparities by anything except for structural racism, requiring education and other strategies. So I'm pointing out some things that I think that you as women may be especially interested in. You could see this season, and this is as of the beginning of November, that African American pregnant women have very low rates of flu vaccination, and lower than anybody else and previous years, little more than 20%. Similarly, children, young people, 6 months to 17 years old, barely a quarter of Black individuals in this age group have received their vaccination. Again, lowest this year in other groups and lowest from other years. If you look at Florida, same story. See what the pretty big gap here, right, between white Floridians and Black Floridians in terms of flu vaccination. This is data from last year, by the way. This year, I couldn't find the data. In case you don't think flu is that important, and I know COVID has really, kind of given us a perspective that we haven't had prior to this pandemic. But the flu has led to almost 2 times more hospitalizations for Black individuals and ICU admissions compared to white. So the flu can produce some pretty bad illness. This slide is just telling you that flu season is getting started. If you look at the rates, it's pretty much the same as not last year, which was an unusual year, but previous years. And you could see the good old state of Florida is starting to move up. It's still low, but it's beginning. There's data from the Florida Health Department. So this is as of the 8th, December 8th. Flu increasing. Here's the outbreaks. It's mild to moderate. It's moving up. You see that? That's going on here. So here is emergency room admissions. And you can see that in previous years, not last year, that's like there were none, but in previous years, this is when you start seeing the emergency room admissions. And we're pretty much tracking the same this year in Florida. I would also just note that 24% of those emergency room admissions are African American Floridians, which is a third higher than the percentage of African Americans in your state. So I just got to say, you guys are super important. You face the most disparities. You actually are a group with the highest number of concerns as well. Hopefully today will provide some information that will be helpful to you and to your families. And that's, I say your families because you guys have the power to influence your spouses and family members in terms of promoting health overall, but also getting the flu vaccine. I know you know this already. We got the power. So I'm going to just share a little bit of information. I know that Dr. Josie McLeod will be able to answer a lot more questions. Basically, everybody over 6 months should get their flu shot every year. And the flu vaccine is not perfect, but we can't let the perfect be the enemy of the good. It does significantly reduce the likelihood of infection and spreading of that infection, as well as severity of disease. This is just a graphic from the last 10 years showing that on average, we've had between 12,000 and 52,000 deaths per year from the flu on average over the last 10 years. A few years ago, it was double that. It was a particularly bad flu season. Lots of hospitalizations per year and, tens of millions of illnesses. So who's at most risk for severe influenza? People who are obese. Some of these issues are actually comparable to COVID as well, by the way. People under 5 years of age, that's not true of COVID. And people over 65 years of age. Pregnant women. People who have immunosuppression due to illness or medication. You see, African Americans are at most risk for severe influenza. People in residential care facilities. And people with chronic medical conditions like diabetes and heart disease and others. I was going to just use this kind of cartoon, if you will, about heart disease. That this is a real risk of the flu. 6 times increased risk of heart attack within 6 days of infection, as well as hospitalization for cardiovascular incidents, stroke, permanent disability, and death from cardiovascular disease due to flu infection. I don't think a lot of us really understood this to be the case even a couple years ago. And so the people who are hospitalized for the flu are not hospitalized only because of the flu illness itself and pneumonia, but the primary burden of hospitalization and death from the flu results from the exacerbation of these chronic illnesses like heart disease and diabetes. So I'm going to stop here. This is my email address. I am glad to hear from you, provide you additional resources. I'm going to invite first Bishop Carter to really talk about his vision and what he sees as the value of this effort. And then Dr. Josie McLeod to really take it over and answer your questions about flu and other clinical issues. So thank you so very much.
Thank you, Laura. I hope that everyone can hear my voice. But I want to thank Dr. Laura for a wonderful slide presentation, helping us to understand how important it is for us to participate in vaccination. Certainly, to my friend Bishop Thomas, long years, I do salute you for the work that you're doing in the Jacksonville community and how you are a trendsetter when it comes to ministry, and to the wonderful sisters who make up the sister circle. Well, Laura said it. When you consider the African American race and when you consider the white race, racism plays a part in this health disparities. Here in Baltimore, we have a partnership with the Johns Hopkins Hospital, and our church is only 2 or 3 blocks away from the hospital. And John Hopkins sit right in the middle of what we would call the hood. And yet there's some strange dichotomies that exist, because you would think an institution who has resources, who have all of the latest in health technology, would lend itself to the community, and that's not the case. And that's a battle that we've been fighting for many years now. We're still fighting. It has gotten better. Certainly, the one who co-chair with me, Dr. Terrace King, he is a consultant to Hopkins as it relates to our community. Our vision, just to say it simply put, our vision is a vision where we have to address these health disparities. We are caught up in diabetes, we're caught up in hypertension, lupus, kidney failure, and the list goes on. And there is no reason why that should exist. When we think in terms of the country that we live in, and when we think in terms of the resources that are available, it's just simply not getting to us. And we're hoping through the effort that we're working through, this effort of partnership with Bishop Thomas and certainly the Open Arms Community Church, we're hoping that we can begin to make a difference. Florida is an interesting state. Of course, your governor, to say the least, is quite interesting. But nevertheless, we're going to push through that. We're going to push over that, because we realize that God has called us to a greater purpose. Every community, when you look at the Jewish community, when you look at some other white communities, they're in better shape than we are. And we have to address that. We've been doing the vaccination centers, as you have in your church and in your community. We've been doing the vaccination sites here in Baltimore. I think we've done something like 10 vaccinations, and each one has been successful. And what the Hopkins understand, what Johns Hopkins understand, is that they cannot get to the people like the church can. The church is the trusted partner in the community. Our community members, I'm sure it's true in Jacksonville, they come to us for help. They come to us for direction. And it's important that we deliver on that. Well, what has happened, because we've been successful in administrating the vaccinations for COVID and even for the flu shot, the church is now being positioned in a way that churches can become or be considered to do what clinics do. And when you look in that direction, then you've got a host of blessings that can come forth for our community, for the people who live in the community, and certainly for the church. I'm just excited. I'm just excited that Dr. Laura Lee, who is very proficient at what she does, has connected with persons like myself and Dr. King for the good of persons of color. And we're just excited that this is just the start. I want you to hear this. The flu vaccine is just the gate, it's just the gateway to our being able to address the other health issues that exist among us. I'm excited, and we're going to keep riding this thing. You know, what better time to launch and to announce this kind of news in this season of celebrating the greatest gift that was ever given to us. And it's out of that gift that we get a chance to experience some other gifts. Again, Bishop Thomas, thank you, man, for your leadership. Thank you, Open Arms, for being able to be a part of this. And what our hope is, your pastor will begin to pull in other pastors in the Jacksonville area so that we can really have the kind of impact in reversing some of these health disparities that has traditionally claimed lives that should not be claiming lives. And we are certainly thankful and grateful for the effort. Laura, I'm going to end right there. And certainly questions, certainly any follow-up, take advantage of what we do want to do in terms of this partnership.
Thank you so much, Bishop. I think we'd be glad to answer questions, but I also want to make sure that Dr. McLeod has an opportunity to kind of provide some information and guidance.
Bishop Thomas, you're wearing quite a few hats: producer, director.
So I'm not hearing anything.
Yeah, I'm not hearing anything either. I think he might have us on mute, Laura.
Yeah, I'm glad to just sit here and see what further they would like to discuss.
Sure.
A lot of us don't like shots just in general. We don't want a needle. We don't want to get this health screenings that we are recommended by our we're afraid, but we can't continue to care for our others. I talked about the COVID vaccine. If you don't want to do it for yourself, then do it for your family. You don't want to spread something to your family and your community that can't be alleviated. The important thing about the influenza vaccine is that, just like the COVID vaccine, it does save lives. The reason that we have a lot of influenza vaccines is because the flu can't kill. A lot of us think, oh, it's just a cold, I might have the sniffles, I may have a little fever, stomach a while. However, it can kill, and especially in those of us who have underlying medical conditions. So one of the conditions she spoke about was obesity. And many of us think, I'm a little thick around the middle, not really ill, but obesity is definitely a medical condition, and it's an epidemic. So it can be the only medical condition that you have, and it can still be very detrimental to your health. Okay. So this one. But again, so influenza can cause major problems like pneumonia and death. And people with heart disease end up with influenza, then that can really cause us, hospitalized and can cause severe death. So one of the things that was noted during the pandemic was there was a lot less influenza. And the reason was because, number one, we were staying away from each other. We were masking, we were washing our hands more so than we do. And we're not saying, that we're not people who are clean. We go to the bathroom, we wash our hands. Before we cook, we wash our hands. But we mean when you're touching things that someone else has touched, you need to make sure to clean your hands every time. Every time I touch this podium, someone else has touched it. So when I leave here, as soon as I get in my car, if I admit to my car, first I'll probably go in there and wash my hands. When I open the door with my elbows or my foot, as soon as I get in my car, I have wipes. You still want to keep that environment clean, and because we are now coming out and being around each other more, then the influenza virus is going to spread. Don't think we're out of the woods because we're lower on the COVID cases. Influenza is still very real. The common cold is still very real, and it's still very contagious. So, at this time, I want to really answer any questions that anyone may have. I know a lot of people who got the COVID vaccine still will say, oh, no, I don't want that flu shot because this is going to give me the flu. So the flu shots, just like the COVID vaccine, is not a live virus. So it will not give you the flu. It can, however, give you some side effects, just like the COVID vaccines can. And most of us may have had a little soreness in our arm. We may even have felt a little feverish or a little headachy, but that's a very temporary symptom or symptoms that the long run benefit is more important. So it's going to keep you from being very ill from the flu. Does it mean you won't get the flu? It does not mean that. Just like having the COVID vaccine does not mean you won't have the coronavirus. It just means that if you obtain it, you will not likely die from it. So this last round of COVID viruses that were hospitalizing patients, the majority of them, over 90% of them who died or were extremely ill, were those who were unvaccinated. Okay, so these variants keep popping up. We said before, it's not over. Most pandemics last way more than 2 years. I'm not sure if anybody realized that or not, but they don't just last 2 years. So when people say we're done, it's over. It's not over, so we still need to be very diligent. We have Omicron now. There's going to be more, but pretty much, I'm going to say over 99% of what's in the community right now is still from the Delta variant. So again, I'm going to go ahead and see if anyone has any specific questions about the influenza vaccine or even the COVID vaccine or any other vaccines. Because remember, probably everybody in here is vaccinated against all the childhood diseases. And by the way, we're seeing some of those come back because of anti-vaxxers. Mumps. Anybody in here seen anybody with mumps? Tetanus. Who has seen someone with tetanus? I've never seen a person with tetanus. There's a reason for that. And speaking of tetanus, tetanus is one of those vaccines that we have to get boosters for. People are wondering, well, why do we have to get another COVID vaccine? Why do we have to get the influenza every year? Well, these do not protect us for a lifetime all the time. The measles, mumps, rubella is one that you have to get maybe about every 10 years. Or some people's immunity kind of wanes, and so you have to get another vaccine to boost. But it's okay. I'm going to get my booster for COVID next week. I'm planning it so that I'm not going to have a busy weekend in case, I become ill from it. And many people may have noticed after they got their second booster for the COVID vaccine that they felt a little worse. Well, that's good. That means your body was fighting it off. Your body has what it needs to fight it off. So the more times you get your vaccines, the more reaction you may have to it. But just be prepared. It's okay. Just be prepared for it. So, sorry, any questions? Yes, ma'am.
Dr. Josie, what about the shoe vaccine? I had
Recording in progress.
No. So what are my chances of it? Should I get that vaccine?
Yes. So the question is about the shingles vaccine, and if you've had the chicken pox, should you get the shingles vaccine? to it, there's probably not very many people, at least my age, who were not at least exposed to the chicken pox. You may not have had an outbreak from it, but you were probably exposed, so that means it was floating around in your system. So what happens is, even once you recover from it, the chickenpox virus lays dormant in your nerve cells. And when you get shingles, that's it coming back out or reactivated. You can also spread shingles to other people. And if you have shingles and you're around a pregnant woman, you may give her that virus and it will affect the baby. So you can also give someone chickenpox from them coming around with shingles. So it's very important if you are 50 and older to get the shingles vaccine. There is one that is recommended, and unfortunately for some insurance companies it is not covered. So if you need to save up for that one, I would. It's not fun to have shingles. You may have the rash, and it goes along what we call the dermatomes or the nerve roots in your skin, and it may give you a rash that's kind of itchy. You may have like a little burning before you even see the rash, but the rash is not the biggest problem. It's what can be caused afterwards. Some people have some chronic pain from that, and they may have to take medications to kind of help that numbness, tingling, burning sensation. And again, you can spread it to others, and you can also get what we call a varicella pneumonia. So yes, shingles is important. There's not going to be any vaccines that we don't recommend. So if there's a vaccine for it, more than likely we're going to recommend that you get it. Anyone 65 or older should be getting the pneumonia vaccines. If you have underlying conditions, you should get it sooner. There are 2 different pneumonia vaccines. You want to talk to your doctor about which one you need it and what point you need it. You get one year, and then you get the other one the next year. Any other questions? Yes, sir.
Yes, I received Johnson & Johnson vaccination. Is that now a booster for the Johnson & Johnson?
So the recommendation right now is yes. If you receive the Johnson & Johnson vaccine, they're actually recommending that you get a booster with any of the other ones. So what happened, I think, with Johnson & Johnson is that they wanted to, create one that was only a single dose. But as we saw, the percentage of effectiveness was a lot lower than the Pfizer and the Moderna. So in my opinion, it pretty much was the same effectiveness as if you only received one of the Pfizer or Moderna. Because once you receive that second one, then your effectiveness rate will go up. Right. And for any of the vaccines that you did receive, the booster is recommended now for everyone. Initially, of course, it was recommended for those who had underlying conditions, and then it was for healthcare workers, but now they're saying anyone should get it, especially with the new variants that are coming. And you can get the booster with any, but it's probably best to stick with the one that you have, except for the Johnson & Johnson. So if you have Moderna, your booster should probably be Moderna. If you have Pfizer, it should probably be the Pfizer.
So which one would you recommend for Johnson & Johnson?
Either probably Moderna, because it seems to show a little bit more effectiveness against the Delta variant. But all the pharmacies have it. I make appointments for my patients every day. Right there, you can do it online. I believe Walgreens may take walk-ins. CVS prefers appointments, but you can make an appointment for any of the pharmacies online, Walmart, Publix. They're free. They will ask you for insurance information because I do believe the funding is supposed to be for those who don't have insurance. Yes, ma'am. Shingles, she wanted to know if it's possible to get shingles after you've had the 2 shots. It is possible to get any virus after you've had the vaccine, but your rates of morbidity and mortality are a lot decreased once you have them. And also, when you have a vaccine, it decreases your ability to spread that virus to others. So it's still protected. Anyone else?
If there's anyone online who would like to ask any questions, you can definitely do so by typing in the thread, and Dr. Joseph will be glad to address them before we conclude this session. Can we say thank you to Dr. Joseph for just a marvelous job? Dr. Joseph is our in-house resident physician at the Open Arms Community Church, and we are doing our very, very best to be the hub of what happens on the north side as well as Jacksonville in this community. As you can hear behind me, we've got quite a few things going on today, but at this moment, our emphasis is on these vaccinations, especially today, the flu vaccination. If you have not received the flu vaccination, it is so important going into this flu season that you protect yourselves. It's not, as Dr. Joseph said, it's not going to hurt you. I've had mine. In fact, I took my first one for the very first time last year, but I've decided now, after so many things going on in the earth, I'm gonna get it every year. And had a little chill here and there, but after that was all over, everything was just fine. All right. Yeah, we have also with us Laura and Bishop Carter and team Blue Cross, Florida Blue, I'm sorry, who, same thing, yeah, who wants to make a quick presentation of 2 minutes on affordable health care that may help someone with these vaccinations.
Hi, good morning, everybody. My name is Robin. I'm a Florida Blue agent. We are thankful and grateful that you guys invited us out to participate this morning. Blue Cross Blue Shield is the same thing as Florida Blue. Florida Blue is our trade name in Florida. Actually, Florida is the only state that doesn't have like Blue Cross or Blue Shield in the name because that's what we use as a trade. It's the same exact company. Sometimes people get confused. We've been around for over 75 years. Very involved in the community. I participate personally in a lot of community events. A lot of times you'll see the Florida Blue table set up. Also, too, we're here to just help people in the community. If you have questions, anything related to healthcare, if you know any people that need healthcare, there's tax credits that you can use to help pay for those for healthcare. So if you know someone has a need, don't sit and think that you may not qualify because your income may be too high, whatever the reason may be. Always come to a professional, ask us those questions, because you'll be surprised exactly how much we can help you get that insurance. And some good plans. These are not, I know you guys sometimes hear Obamacare or whatever. Obamacare is just a law. It's really Affordable Care Act. Okay, ACA, you will hear me say ACA or ACA. When you see the healthcare.gov commercials, that's what Affordable Care is. Obamacare is a name that was given. It's not a real name. However, all it is a law that says if you qualify, that you will get a tax credit to help you pay for health insurance. So it is a tax credit, so it's income-based, age-based, whether you smoke, how many independents you file on your taxes. But you'll be very surprised. Sometimes people pay nothing, sometimes people pay $10, some people pay $200. The older you get, your healthcare costs more. Also, we do Medicare as well. So we have Medicare Advantage plans. If you guys have any questions about the Medicare benefits at all, whatever it may be, and also the shingles vaccine is normally covered under our plans. So if anybody has any questions, feel free to call me. I'm at the back table. We have cards up there. Our office is in Orange Park Mall, but we work the whole state of Florida. So anytime you guys need us, we're here. Does anybody have any questions while I'm up here? Thank you all for having me. Have a good day.
Thank you, Sister Robin. Laura, is there anything else you would like to share before we conclude this session?
I just wish all of you a wonderful holiday season, every blessing. And I had given out my email address, llhall@nmqf.org. Glad to answer any questions now or in the future. And I look forward to working with you all moving forward. So thank you so much, Bishop.
Thank you, Laura, and to all of our team. Can we have another great big round of applause? And as we close, Bishop Carter, thank you again so much. Chenny, who has been our secretary and helped me stay informed, thank you so much, who's on the thread as well. And again, I want to say thank you to those of you who came out today to be a part of this session. And we're going to be ongoing as the years go by. God bless you. If you want to tell somebody about the stream, they can go back and watch it once this broadcast has concluded. God bless. Have a great day.
Peace.
To the audience, give me some more hands. Bye-bye.